Hi everybody, this is Roberto Parker again with Innovative Sports Training. Time for another Health Detective Talk today. Today's topic is one of those topics that I really don't like talking about, but it's a very hot topic today. It's talked about a lot and there's some misinformation on it that I feel that's a little bit misleading and people are hitting the panic buttons a little bit. That topic is chronic trauma encephalopathy. Please don't make me say that again. In other words, concussions. Now today I'm going to take my time explaining this. This might be about a 10 to 12 minute presentation today, so bear with me. If you're watching this and you don't really have an interest in it, please pass it along to someone else that does. If you're involved in a sport in which is a high contact, high impact type of sport, football, obviously, the NFL is a big concern for a lot of people today. Football, basketball, baseball, you might get struck with a ball in your head, wrestling, boxing, NASCAR, any sport where there's a lot of high impact or trauma, you need to watch this. And if you're a parent who has a child involved in the sports, watch this. Pass it along to someone that you love, someone that's a friend of yours, a neighbor. Take good notes today. At the end of this presentation, at the bottom of the page, I will give you some references of individuals who are highly known practitioners in the field of CTE and diet. Now, today's topic, I'm going to focus more on the diet aspect of how to deal with CTE. Let me just say this. You're not going to eat a magical diet, so to speak. I really don't like that word at times, in order to prevent concussions. However, you can have the right diet or nutritional plan established, which will help you to reduce the severity of the concussions and the symptoms of the concussions, and possibly even reverse much of the potential damage from a concussion if you establish a good eating plan. Prior to, during, or not during obviously, prior to and after the trauma happens. So today I'm going to have to go to my computer and I'm going to, find my spot here. Chronic traumatic encephalopathy, so I had to say it again, CTE. That's just a nice technical term, a nice elaborate term for concussion. And basically, what that is, it is acute inflammation that starts out acute. But the problem occurs when it becomes chronic inflammation. Just like any other part of your body. If I do this, I've demonstrated this before with you. If I do this for just 5 or 10 seconds, no big deal. But if I do this for the next 8 hours, I would develop inflation in my arm around my bicep area. I would start to tear tissue down. Well, the brain is the same way. It does not like chronic inflammation, a bruised brain. Now, the problem that you have a lot with concussions is a thing called second impact syndrome. And what that is, basically, it is a second concussion that occurs before the first concussion is properly healed, causing swelling and inflammation, obviously, and also some very bad stuff happening. Now, you can incur a concussion not just from direct hitting your head on something, but also just being shaken or jarred heavily. So everybody thinks it's just hitting your head against a heavy object. I mean, hey, look, I was a kid one time. I rode bikes without helmets because back in those days we didn't do it. I fell off my bike a few times. And maybe I even had a slight concussion and didn't even realize it. But all I'm saying today is, guys, you can incur a concussion without necessarily jarring or hitting your head. You can incur a concussion just by being shaken real aggressively or jarred real aggressively. Now, the point I want to make is this. After you've been diagnosed with a concussion, the 8 to 12 weeks, the first 8 to 12 weeks post-concussion trauma is the most important time for you to really be conscientious of what you're eating. I'll go into that at the very end here, more details on the types of foods. Because that is the time a healthy diet will possibly prevent that second concussion syndrome from occurring. And if it does occur, the proper eating plan will reduce the symptoms and the trauma of that second concussion syndrome that may occur during that 8 to 12 weeks. So that's a very crucial window that you have to be very, very conscientious of. Okay, a well-functioning blood-brain barrier will prevent toxins from entering the tissues. If the BBB is permeable, toxin inflammation will take over and damage the brain tissue. And gluten, which is found in not just wheat, but other products too, even certain condiments, gluten will increase the permeability of the blood-brain barrier. I'm going to demonstrate on the board here right now. The purple represents brain tissue. The black kind of checkerboard type things here represent the barrier. That is the blood-brain barrier, the guardian. The little smiley faces, and this guy here doesn't have a smiley face, but he has a black hat, just like the bad guys with a black hat in the old cowboy movies, right? That's the good stuff and the bad stuff in the blood that wants to possibly pass through the barrier and get into the blood tissue. Now, the blood-brain barrier will allow certain things to the brain tissue that is good stuff. That's just the natural way of doing things. That's how God created us. However, if you've had CTE and you've already entered that second phase of the concussion, you're going to possibly damage that blood-brain barrier. There's no possibility about it. You have already damaged it just from the impact itself. And if you're consuming a diet that is not very conducive for healing, you're going to increase the potential of these bad guys getting in there. And once those bad guys get in there to the brain tissue, all kinds of nasty things will happen and occur. You have to be very, very conscientious of that. So, once again, good stuff, bad stuff. Blood-brain barrier. This blue represents the blood. Over here, I forgot to put the blood in there, but there it is. Okay? You want to keep out the bad stuff and let in the good stuff. As you can see here, the wall has been compromised. Okay? There's like a leaky faucet right there that's allowing the bad stuff to get in there to the brain tissue. Not good. That will cause more inflammation. On top of this, you've already got inflammation from the trauma itself. Now you're adding to the trauma by not eating the right type of healthy foods in your diet. Okay, now the brain, in conjunction with the rest of the body, can function on two energy sources: glucose or ketones. Now, here's the problem. A bruised brain will not uptake glucose very efficiently. And by the way, even as you age, as you become older, your brain's ability to uptake glucose for energy starts to diminish. That is why I recommend, and other professionals in the field who are a lot smarter than I am recommend, that you, especially during that 8 to 12 week window, get on a good ketosis diet. That means a lot of fat and very, very, very minimal carbohydrates, because the brain will use ketones much more efficiently, and a ketone diet will send more oxygen to the brain and help to reduce the pro-inflammatory environment that's going on within the brain, as opposed to glucose. Glucose is a less efficient energy source than ketones. Ketones take some work to get there, but baby, are they efficient. in that they're also a very clean source for the brain. Now, there's 3 types of ketones for the body. Acetone, acetoacetic acid, and BHB, which is beta hydroxybutyrate. Okay, that's not really that important necessarily if you're a lay person out there, but those are the 3 ketone bodies that your body must utilize to get into a good ketosis-like state. Now, in order to establish ketosis, you have to get on at least an 80% fat in your diet. Good, healthy fats in your diet. You've got to minimize the carbs and even really minimize, I'm going to say minimize to moderate levels of protein. Once again, a diet like that will carry more oxygen to the brain and by producing ketones. Now, saturated fats are probably one of the best sources to get on a good ketosis type of eating plan. Now, the advantage of saturated fats is that they will not become oxidized. Carbohydrates will become oxidized. And oxidation is like rust. So if I left a nail outside in the weather for several days, after humid weather or rain or something, that nail would become rusty. It became oxidized. That's what oxidation in the body is. So when you're consuming a lot of carbohydrates and low amounts of fat, and you're not very active, your body will become more oxidized. And so if you had CTE and you're in that phase, that 8 to 12 weeks, and possibly that second concussion syndrome starts to occur, you better get on a good, high fat eating plan for that 8 to 12 weeks. It is crucial for your recovery. Okay, trans fats are not good. Now, trans fats are stuff that, and hot dogs and bologna. Don't get that garbage because that's bad stuff. I'll go into some details in a minute of the type of foods. Now, they have also found with the ketone eating plan that it's also good treatment for ADD, anxiety, autism, and even PTSD that a lot of military people suffer from that come back from war. So getting on a good high-fat diet where you can bring on ketosis in the body is also good for those types of individuals. Particularly omega-3 fats, not omega-6, omega-3 fats. Now I'll get into the types of foods that you should be eating and you should not be eating. Avocados, black olives, wild game, grass-fed meats, cage-free eggs. Now, carbohydrates, you got to have some, right? Some starch. Don't eat dumb carbs, as I call them. Eat smart carbs. Smart carbs are leafy green vegetables. Consume fruit that is very high in fiber, like blackberries and blueberries. Fruits that are really dark. In fact, getting back to the vegetables, get the vegetables that are highly bright in color, bright reds, bright greens, bright yellows. Those that have good sources of what we call polyphenols. Those feed the brain in a good way. Another good thing to consume are fermented foods and bitter herbs. Now, if you read the Bible, which I do quite often myself, I'm not trying to push my faith on anybody here, but it talks about bitter herbs in the Bible. Bitter herbs and fermented foods are great sources of pre- and probiotics for the gut. In order to reduce the symptomology of brain trauma, you have to have a good, clean gut. This can also apply to your gut, by the way. If you have a leaky gut, chances are you're doing damage to your brain tissue, especially if you suffered CTE. You've got to get that gut healthy. For every message that the brain sends to the gut sends 9 messages back to the brain. Think about that. Curcumin, which is found in turmeric, is also a very powerful antioxidant. I highly recommend getting on that. That can play a huge role in reducing inflammation, not just in your brain, but your joints and everywhere in your body. Okay, now the foods you want to stay away from to avoid. Dairy, get off of it. Gluten, obviously, I talked about that before. I can really compromise the blood-brain barrier here. Grains and breads. High-carb fruits. Alcohol. Alcohol converts to sugar in your body. So to wrap it up here, guys, let me just say this. If you play a sport or activity that has the high potential of CTE or brain impact, you've got to clean up your gut. You've got to do that. That first 8 to 12 weeks is crucial for you. And here's the thing. Here's what I recommend to you parents out there, and also if you're an athlete in a high contact sport. Get on a good high fat diet now with good sources also of probiotics. Because here's the thing. If a concussion does occur, you already got the table set. You're already 50%, you've already got 50% of the battle won right there. Because your environment is already pretty good and pretty cleaned up. Because if you're in a high carb, high processed carb in particular type of diet, believe it or not, you already have inflammation in your body. And probably some inflammation of the brain. So if you clean that up right now, get on a good clean plan, and if you do, God forbid, I'm not wishing for this to happen, but if a concussion does happen, you are set. You already won half the battle because now your gut is cleaned up. Your gut's going to resemble this. Nice, clean, healthy, tight junction permeability of the gut. And that will increase the potential of good brain health, good neuroprotective health of the brain. Now also, having said that, you will expedite the healing process if you were to incur CTE, and possibly even reversing CTE. And once again, guys, I'm not making any promises out there to you. I'm not a medical doctor. I'm a trainer. I'm a practitioner who looks at the body holistically. I peel away the layers to find out what are the hidden stressors going on within your body that can lead to a very bad disease process within the body. Inflammation is a disease. Oxidation is a disease. And if you reduce or eliminate that process before anything like a concussion or some sort of brain trauma happens to you, like I said before, you won half the battle. You will heal much faster, and chances are you will reverse it. Guys, I hope this has helped you. This has been kind of a long one today, but I believe it's been well worth it. Now, the next series is going to be on managing concussions related to exercise and therapeutic modalities. So stay tuned for that. Once again, guys, if you need any help with anything out there, I do lifestyle assessments, hormone assessments, nutritional assessments, blood analysis. Getting back to the concussion, there are certain blood markers I would look for if you're going through that concussive state right now to see how well you're progressing. A big one is cortisol, but that's just one. I do blood analysis, I do urine analysis, I do saliva analysis for cortisol rhythmic tests. So contact me. My number is 816-405-7703. My email is rwpsports@yahoo.com. I do private consultations, 30-minute, one time only. I do classes and private sessions. Guys, take care of yourselves. God bless.